We're the hydradenitis super divas. If you've got HS, you'll want to meet us. It's not your fault, put the shame to a halt. HS divas know how to have a ball. The hydradenitis super divas. Put the shame to a halt, cause it's not your fault.
Hi everybody, this is Brindley with HS Connect and Cyd, Social Cyd, and welcome to this episode of the Hydradenitis Super Divas. We are here today with a special guest from Tono Health, which you've heard us talk about before. It's Dr. Mandy Ghias, and she is joining us today to talk to us about Tono Health. Since we've talked about it so much, we're going to actually get it straight from her. And wanted to just kind of touch base with you, find out more for the HS community about Tono Health, how you guys got started. We know that you have HS specialists, which is amazing for our community. So can you tell us like a little bit about how you got started, and then we'll get into all the other juicy questions?
Yes, absolutely. And thank you so much for having me. What you've built and what you've created is absolutely incredible. And I am so excited to be here.
Oh, thank you.
So Tono Health is a virtual dermatology practice, and we specialize in HS. And so we have this incredible group of doctors. They are amazing, and they're HS specialists, which we know is so hard to come by. And we have medical practices in 20 states now. So we're able to treat patients in over 70% of the US population. We most recently added Texas, which I know, Brindley, you and I have been chatting about as of yesterday. So we're super excited. We're continuing to expand because we really want to just increase access to HS specialists for patients all across the country. I feel like it's a huge area of need. It's something that patients want and deserve. So that's what we're really focused on.
Yeah, and I swear, every time I talk to you, you've added at least 2 states. It's like we can't go a month without talking and adding on states, which is amazing growth. And not an easy feat.
It definitely isn't, especially as, that first batch where we've started to kind of like plateau, every state has individual requirements, lots of paperwork, but it's incredibly rewarding because I feel like every time we expand to a new state, it's almost like, there are a group of patients or, just people there that currently didn't have access or just didn't have another option. And so being able to reach those people and be like, hey, we have added this other location instead of being like, it's on our list, is super impactful and keeps us going.
So I know one of your goals at Tono Health is to see patients within like 3 days of them reaching out for an appointment. So can you fill us in a little bit more on that? Because that sounds really nice, especially when we're like at 9 months to a year waits for a lot.
Yes, absolutely. I think that getting timely access to knowledgeable care is so important. We talk so much about this whole window of opportunity and wanting to really decrease that as much as possible so that we're getting patients access to care before there's this irreversible damage and scarring. The within 3 days timeframe is definitely desirable because a lot of patients first reach out when they're having a really bad flare and, they've, or maybe they've had other bad experiences, et cetera. And so it's kind of like, there's something to just, building rapport and establishing care closer to that patient outreach of like going, maybe out of their comfort zone or something and signing up and wanting to make an appointment and finding the provider that's going to be a really great fit for them. So that's been really great. Sometimes, between the patient and the provider schedules, maybe it's like a week or 2 weeks, but we really try to minimize it as much as possible and give them optionality. And a lot of times they're like, all right, I've been waiting, several years, so a week isn't, but it makes a huge difference also for the follow-ups. Or, if someone has a flare and needs something, being able to get in touch with your doctor really promptly is so instrumental in just giving patients like that sense of security and peace of mind of knowing that like there's someone else there that is, wants to partner with them and wants to ensure that like they feel supported and helping them through the process.
Yeah, I think that you hit on a keynote when you said partner, and I feel like we have talked so much about that. Like, for an HS patient, we need a partner in our care. That's truly what we need. We're your marathoners. We're not your sprinters. We're like the see us through. We promise we'll be worth it at the end, if you just hang with us. So tell me a little bit more about like how you would work if a patient is a Tono Health patient and they're having an acute flare and need an injection, let's say. How would they go about doing that with you guys?
Yes, so that is a great question. We really partner with local providers. So, whether it's a local dermatologist or a local provider that is able to provide basically any of the in-person services that someone might need. So whether it's a intramuscular injection, intralesional steroid injection, or even facilitating surgeries that are local to the patient, helping them to kind of like gauge who is the best fit for them, has been really, really helpful, because the goal is that we definitely want to partner with those local providers, because it's like, again, we're virtual, we're overall managing like the HS aspect and providing that like specialist level of care. And it's really, really helpful to have in-person partners that that we can trust, that we can work with, kind of like almost like guide sometimes, depending on the situation, and work together because we all have the shared goal of we want the patient to get better. How do we make this happen? And I think everyone is aligned in that.
And then then you follow up with them like after they've had their injection as well and just check back in on them. So I think one of the benefits I think in this is that you have this like direct messaging. First of all, your platform is amazing. And it's super user friendly, which is a huge benefit. You can upload photos if you want. And then the messaging app piece of it is also super user friendly. And I've heard feedback from other people that you guys do a great job of responding and getting back timely. And I think that's a huge benefit for the community, because there's oftentimes you don't have direct access to someone. Even if you have an MA's phone number and you need an injection, like there's no guarantee anyone's going to call you back. And you kind of feel like you're left to your own devices sometimes. So yeah. I mean, I feel like even though it's a virtual, which some people are still like a little bit leery about, like, how do we do this virtual thing? How do I get the care that I need, even though you can't like physically touch me? Let me tell you, there's a ton of people that you're seeing that are doing it and it's working.
Yeah.
And that goes for everything. Like we had talked before about another case where you prescribe all the meds, you work on getting them, if they need infusions, you work on setting that up.
Yeah, absolutely. I mean, that part has been huge. Like, we have patients on daily IV ertapenem, infliximab, infusions, I think are really manageable, especially by working with these home infusion companies. And a lot of times the patients prefer it because they're like, okay, I can have this done, on my time instead of having to go somewhere every day or, every 4 weeks out of my way. They have weekend availabilities. I think it's just much more flexible and can work around the patient's lifestyle. I think that has been a really huge aspect, is just giving patients the flexibility so that, HS is a part of their life, but it isn't, like taking over things. Like they can't go. Yeah, exactly. It's giving them power back so that they don't have to take off of work if they don't want to. We're really flexible with like having slightly like more evening appointments. And then, from East Coast to West Coast, that means that, for our West Coast providers, like seeing someone on the East Coast in the evening is still during their preferred hours. And so it's just made this whole connected care model, so much more impactful to be able to like provide that flexibility and to work with the patients instead of just being like, hi, you need to take off work, you need to travel here, you need to sit in the waiting room, etc. Yeah, and then another thing in addition to the photos that you mentioned that stuck out is videos. I feel like a lot of patients have really loved, uploading videos if they are having a flare or want to like almost document or like describe something to their doctor more, just more in real time. And so that has been really helpful because again, let's say I see them a couple days later, etc. There's something about like almost like having that play-by-play of their experience that can add a lot of value for people who, want to share that. It's by no means a requirement, but it's just been something that, has been helpful when people want that as part of their care.
Especially with HS, knowing that like sometimes, especially like without Tono Health, it's easy to make a dermatologist appointment, be flaring in the midst of like the heart of the storm, and then actually go to the appointment and you're like, the flare has done its thing, and it's like doesn't look the same.
Yeah.
And it's almost like you feel this guilt, like you're wasting somebody's time because it's not as bad as it was when I made the appointment. So I feel like cutting the time down between how close you can get somebody to see a dermatologist is amazing. And then also providing them with that tool to be like, you could take a picture, you could use a video, like it's helping so much in the HS community. So that's awesome. I have a question about insurance. So does it matter what insurance you have to be able to use Tono Health?
Yes. So again, great questions. With insurance, our goal was always to, have the care covered by patient's insurance. So we are covering most insurances. Again, every time we're in a new state, you need to go through this whole process all over again. We have a lot of really great advisors and partners that, have been helping us with like, with Blue Cross Blue Shield, et cetera, and all the major plans. And so while it's covered by many insurances, we're still working on, getting it covered by all insurances. And the team is really helpful in working with patients on a case-by-case basis to find an option that is affordable and reasonable, that works with them, especially while we're still, working on finalizing or like continuing to expand the insurance coverage.
So if they had a question about whether their insurance was covered, should they reach out to you guys? Because I think it would probably be easier to go that direction instead of the other direction, reaching out to their insurance. Yeah.
Do you cover Tono Health?
Yeah, they're like, I'm sorry, who?
Yeah.
Yeah.
Yeah, because it's basically like the same as, we do live video visits. And so in terms of the medical visit, it's generally the same as an in-person doctor. And, the medications are still covered by the pharmacy benefits. Again, there's a lot of different insurance plans out there. And so, on a case-by-case basis, or like if someone has a high deductible, et cetera, lots of nuances to the insurance landscape that we've gotten to be more familiar with, and that the business side of Tono gets to handle because it's not my preferred area to focus on, but it's a very real aspect. But, I think that what stays at the forefront is just ensuring that we're making the experience and the care affordable, accessible, because that's really the overarching thesis is like, how do we expand access for patients across the board?
Yeah. And I think, you guys are an answered prayer for so many people who live in rural areas too. Not even for people who live in major metropolitan areas, it's a different benefit that way, right? It's that you get in much quicker.
Right.
You have,
forever.
the access is much more available.
Yes.
And then for the people who live in rural areas, not only are they getting the quicker access, but they don't have to do that drive to a specialist that can potentially be flare inducing as well on its own, or be in pain in a car for that long of a period of time. So I think, what you guys are doing is amazing. And I think it's so helpful, and not only for HS, but all dermatologic conditions too. Just everything and anything is you guys are just answering so many prayers for people who, don't have access to this kind of higher quality and specialized care in the past. And that's amazing.
Yeah, no, thank you so much. It is one other thing that has really resonated with me is giving people optionality in their doctors, and especially when it comes to patients that may live in an area that doesn't have as many options of dermatologists. I mean, again, I think it's about giving patients back power over their health and over their experiences, and being like, hey, if there's one dermatologist in your entire county, and maybe they're just, again, everyone isn't a good fit for everybody. How do we get you with someone that you do connect with, that does resonate, and that you feel like you want to have this partnership that we've been talking about with, instead of it being just not a good combination, which is going to happen. Sometimes it's probably like dating, where it's you're trying to figure out is this person right for me? I don't know. And we want people to have that positive experience. And so giving them options of HS specialists, and then also asking them hey, what are your preferences? What's important to you? Do you want someone that is the same gender as you? Do you want someone that specializes in your condition, which is obviously, for the HS patients has been very top of mind, but there's a lot of other things like language that come up, for non-English speaking patients. Yeah, it probably is helpful to have a doctor that speaks their language. So providing that flexibility has been really helpful.
It's kind of like a concierge service. I mean, really, you're
let me know when you come to Colorado.
I know, what do you need? What do you need? I got you, I mean, it's amazing, because you're right. I think there's so many non-HS specialists that we end up seeing and having negative experiences at, and then it taints your experience about going back to a specialist. So we just choose not to, because there's medical trauma involved in that, and then you just bury your head in the sand, pretend your condition doesn't exist, although it's raging out, doesn't care about your desire not to.
Doesn't care that you don't care.
Yeah, exactly. And then having the autonomy to make those kinds of decisions and to help direct and guide your care, I think it also sets the tone for patients to be more involved in their own healthcare and become their own advocates through that, because you're giving so many options and supplying them with the ability to make some of those decisions.
Yeah, it's about empowering them to be able to make that decision, and just to not have something forced because there is no other way. It's my way or no way, which I think used to be the case a lot more often in healthcare. But again, I think with HS, for example, just given the locations, maybe male patients are I'm sure Dr. Ghias is great, but I would prefer to see a male doctor. That is totally understandable. I completely understand. There's no need to almost make someone explain that, or have to, if that's someone's preference, we want to empower them to be able to see a male HS specialist, so I think that has also been just an interesting realization as we've gone through this process is, a lot of my panels end up being much more female focused, and a lot of the male doctors patients end up being more male focused. I don't know why, but it's generally just, something that we've noticed. I don't know.
Yeah, and it makes perfect sense, because I mean, you tend to be more comfortable, especially sometimes the areas that it affects us in,
exactly.
And that's great that you have the option to do that too, because not a lot of, when you're in a one derm town, let's call it, I mean, I feel like we need the woo woo. Then that's it. That is your only option. And so I'm super excited about what's to come for you guys and for patients.
Yeah.
To see the landscape and how it's changing, and that this opportunity is more at their fingertips than it ever has been before.
I'm interested to know. Oh, sorry. What is the process of somebody who just found out that Tono Health is available in their state? What
Mhm.
would they do exactly?
Yeah, again, great question. So you could go to tonohealth.com and click Get Started. It's on the top right-hand side, other areas of the page. And then you just sign up, and basically then someone from the scheduling team would reach out. You fill out an intake form. It guides you through the process and makes it, really easy for the patient to just put in their medical information, and then the appointment gets scheduled, and then they meet with their doctor.
Wow, super, super simple.
Yeah. And then,
So as long as you're in a state that you guys offer, your
Mhm.
chances of landing that appointment is pretty
Yes.
good.
Yes,
I'm just
absolutely.
always the only exception. I know you guys aren't in Colorado yet, but I'm like, I just want to make sure that I'm feeding this information to my community, right? And then I also want to know, like, how is it that you guys find new patients? Like,
Yeah.
how do you find them?
So, I mean, a lot of different ways. I would say sometimes, it is through existing patients, through patient advocacy groups like yourselves, and a lot of times also through other physicians that we partner with. So I think that a really like symbiotic partnership has been with HS surgeons. Because we're able to provide, medical management for the patients before and after the surgeries, and because we know that a lot of patients are going to need, or many patients might need some type of surgical intervention. And so it's kind of this really nice, just symbiotic, like we refer patients to them and vice versa. And so, that's definitely been a really big way that we've been seeing patients, is like, with those surgeons who focus more on HS, being like, okay, I think that the outcomes would be better if their HS was under, better control before the surgery.
Okay, nice.
Yeah. It's such an amazing service. I'm so excited to be a part of what you guys are doing and like to help tell patients about it. It's so exciting for people to have another option
Yeah.
in their tool belt too.
Yeah, and I mean, we love, also working with you, and working with HS Connect has been so instrumental in, giving us that connection like to the patients, because again, I think that, and something that you mentioned earlier about like the concierge service thing, it's like this shouldn't really be considered a concierge service, like the ideal world in 5 to 10 years is that most of healthcare should be functioning like this. I mean, if you think about it, like every other industry in the US
Functions this fast, except for healthcare.
exactly, except for healthcare. It's the only one. So this wouldn't, like, having a patient like scheduled, within a reasonable time frame isn't like, whoa.
Yeah.
You have more than one option?
Except that it is.
I know, except for in healthcare, and more specific, and with each specialty it becomes harder and harder, which I think is why increasing like that connectivity and just the ways that we're able to communicate. I mean, even the way that we're able to communicate right now, it just really opens the opportunities for these different care models that can provide more options to patients across the board.
Yeah.
That's so awesome. I just want to go shout it from the rooftops. Is there a way I can find all of the states that you guys are available in on your website?
Yes, absolutely. So if you go to tonohealth.com and click on the About page, it has, the fully updated list of the 20 states. And, in a lighter purple, it shows states that we are close to finalizing. So Arizona, Nevada, are currently on the list. And yeah, so that will have the most up-to-date information We're also working on relaunching our HS page, which I really, really appreciate, Brindley, your amazing feedback on. I think that has been super helpful because I think it is a really important part of building this special experience is keeping people at the forefront, right? And I think in healthcare, a lot of times it's so disaggregated or just disconnected where the people building the tech have zero interaction with patients. So something that's been really just insightful, and the engineers actually love it, is having patients come talk to them and sharing their story. It gives them so many different ideas that I would never ever in a million years have thought of, that they're like, oh wow, I actually think that we should have it like this, but from a product development standpoint. So that's been super helpful just in we want to make sure that the experience and the experience and the care is what people want and need, and not, something that we're just assuming.
Yeah, and we'll link the states map in the show notes and Tono Health in the show notes so that we have all of that handy for anybody who's looking
I'm
to.
already my wheels are turning. I'm like, Brindley, can you email her about a marketing? What's their marketing budget? Because I have so many ideas on how I can say this to my community, and hopefully the ones that you guys are available in their states, they're able to utilize you guys as a resource and just help bridge that gap between the long delay of appointment wait before they could get to the dermatologist. So I'm already wheels turning, what trend can I do? Oh my God, it would be so amazing. And I know it will help so many people. So thank you so much for sharing with me. I think it's a genius thing that you guys are doing.
Oh, thank you.
We absolutely love it. Huge fans, obviously. Huge fans.
Thing. Well, likewise. That's why we're here.
I know, exactly. Dr. Ghias, thank you so much for joining us today, and thank you for telling us and filling us in on Tono Health and all that you guys offer and what shouldn't be considered a concierge service, but really is right now where we are in healthcare. And hopefully one day will be totally standard care. It was so great to talk to you and to learn more about Tono Health and how you can help patients, especially our HS community. And we look forward to learning more at a later date. So thank you again.
Thank you again for having me.
All right, everybody, we're out.
All right, guys, thank you so much for tuning into this episode of Hidradenitis Suppurativa. We hope that it was impactful. If you happen to be in any of these states where Tono Health is offered, please hop on it. It sounds like a dream, an HS dream come true. So I know it sounds too good to be true, but go see if your state's available.
Chief, just talk to us. We know they're real.
But thank you so much for hopping on and feeding us this information. And like we said, we hope it impacted you in some way. Make sure you subscribe so you do not miss the next episode. Bye, guys.
Bye.